record on my computer. All right. Hi, my name is Liz. My comrade Taylor is not here tonight. She's busy doing internship stuff at Le Bonheur, but we are so excited that you have joined us again tonight for our second game night of this session. Tonight we have a special guest, Shelly, who is a CCLS and who is really amazing at helping out students and really loves helping out students. So we're very happy to have her on tonight. So if you have any questions for Shelly, Shelly can introduce herself while you kind of throw some in the chat.
Yeah, thanks for having me tonight. Yeah, I'm Shelly. I've been a child life specialist for over 20 years now and love what I do. I've met Elizabeth through supporting the Child Life Journey. It was just a little support group we have going for aspiring child life specialists. And yeah, anything you want to know, just ask. I see one question about how to sound sincere. Yes, you want to sound sincere. My best advice is be authentic. You know, don't try to say what you think they want you to say. Just be yourself. I do try to have two versions of why I want to be a child life specialist. My elevator spiel, which is like in 30 seconds or less, you know, why I want to do this, but then also have the my story, be like, how did you find it? What impact did this field have on you? And why is it so important to become a specialist? So have that 15 to 30 second version and have that 2-minute version.
What would you include in the 30-second version?
So just think about like, okay, I got this one elevator ride with this person and that's like, oh my gosh, this is the medical director just hopped into the elevator with me. So I would say talk about the impact it has on children and families and why that's so important to you. I think one of the biggest things that we can do as child life specialists is normalize the experience for the child and support the family so that they can in turn support and help the child be self-sufficient. So that patient family-centered care is a real, I think, key piece that Child Life does so well among hospital staff.
Okay, so Jules, I'd love a little bit more background about this question. So have they not reached out to, have you got an interview there and they just haven't confirmed it yet?
No, so I applied to 3 places and none of them have like reached out for an interview yet, and I'm like starting to freak out because it's getting late. And my mom said like if I called, I don't even have to say my name. I could just be like, hi, I'm a student. Like I'm wondering what the interview timeline is like. Like, is that okay? Or to say like, oh, are the interviews on Zoom? Like just something, just so I know if I still have a shot at that hospital right now.
When did you submit, or when did you last have communication with them?
Well, I submitted my application on December 22nd, but it wasn't due till January 5th.
Okay, yeah. 2 weeks is a great time to follow up. Okay. I think that's fine. Yeah, again, and just like you said, hey, just looking for the parameters. What are the guidelines? You know, when can I expect a yay or nay?
Okay. I also have another question, if I can ask that.
Yeah, go ahead.
So I have 2 feeding tubes, and I don't know, like, what if they ask me like anything like that, and I have to tell them that I have feeding tubes, or if I need to do a feeding while I'm at the practicum, like, is that going to affect if I get it? Because I might have to run feeds during a shift.
So they can't discriminate against that. So it's totally up to your discretion if you wish to share that or not.
Okay.
You know, if you feel like you'll need special accommodations, you know, I would just ask for it, but you're under no obligation to share that as long as you act appropriately among the patients and families. So like, i.e. don't do your own feeding change in a patient area.
Well, yeah, I know.
Right. Yeah. So,
Yeah.
just common sense stuff like that. So that's totally up to you.
Thanks.
In putting my own feedback or thoughts into that too, it does take hospitals a while to go through and look at all the applications. So it could just be that they haven't gotten through all the applications and thus they haven't gotten through to the interview process yet. So it could just be you start to hear next week or something like that. So I would just continue to be patient, continue to just wait, and you should be hearing a yay or a nay within the next couple weeks, I would say. Especially if they do the ACLP guidelines, that you should be hearing for an interview within the next like week or two, I would think. Yeah, week or two. Next couple weeks is like the interview timeline. So,
Okay, thank you.
yep. Okay, it looks like our next question is, I had my volunteering set up before COVID, but then it was canceled. Do you have any idea if there's anything I can do in the meantime until volunteers are allowed at the hospital near me again? I can't go for internships because I haven't volunteered yet, but I have taken courses.
Yes, we appreciate how you're kind of in purgatory right now with all this COVID stuff. And so one of the things, I'm part of the education and training committee with the ACLP, and we put out a resource list. Well, actually, we collaborate with Belinda Hammond, so kudos to Belinda with the Child Life Collection.
He's coming next week to
Is she? We
talk
love
to us too.
So, give her a big hug for me, please. So we have a resource list, which I'm trying to pull up for you, and I'll drop in the chat box once I get it pulled up. But basically, it's just a list of ideas of what you can do in lieu of while you're waiting for this time to get back into the hospital settings. But also, don't be afraid to go outside the hospital. Be creative. Any chance you can help children and their families, it's a really great experience.
Also, I do believe Project Sunshine has teleplay opportunities that would be hospital volunteering. So that could be a way that you could get a little hospital experience. But also there's just a ton of different volunteer experiences happening right now. I know probably a lot of summer camps are going to be virtual this summer. So maybe volunteering for some summer camps as well. Just
Great.
things to look into. I'm pretty sure there's like if you search on the Child Life Connection Facebook page, I'm pretty sure there's like, they have a like thread that's like volunteer opportunities. So I would check that out as well. Okay, so my next question is, what advice do you have for people going through the internship process, people who are waiting to hear from internships, and people who will get internships soon? What advice do you have for those people?
Well, first thing I suggest is give yourself a big old pat on the back. It is such a process. So kudos for even attempting to get through it. It is strenuous. So that's the first thing. Second thing, this is my 2 cents, but I say apply everywhere. You got nothing to lose. Now, obviously, do that within your financial budget. Unfortunately, it's gotten really expensive, which is another thing I brought up to the education and training committee. I was like, guys, come on, why are we charging an arm and a leg for all these things? But each hospital is different, so we really can't control all that, but we're trying to spread the word. So apply everywhere, be diverse, don't be afraid to stretch outside your comfort zone, try something new or a new place. And third, I would say, and this probably sounds like a broken record, but that foundation of child life is based off theory and play. So get really comfortable with theorists And you need to demonstrate that you can play. Not that you can observe play, but that you can play.
Okay, all great advice. Do you have any suggestions for people who are trying to integrate theory more in their answers of ways that we can do that for interview questions?
Yeah, while still sounding sincere.
Yes.
Uh, for me personally, you can tell, right? You can tell when someone's really excited about it, even if they're nervous, just like, man, I just love this stuff. I can't get enough of it. So I kind of like to hear like who your favorite theorist is and why. And you could even say that, be like, hey, I'm studying, I'm taking this class, just kind of give a little backstory and like, hey, I discovered this cool thing. Yeah, I had no idea about Erickson. This is so awesome. Then I got to see it in action, like kind of just give examples of how you eat, breathe, and live it. Even if it's something that's real standard, and be like, they'll be like, oh, everybody probably talks about Erickson. Be like, oh my gosh, I saw assimilation the other day when I was out at the grocery store. It was so cool. And just, give that, show your enthusiasm if it's genuine. Don't try to make something up, but just show them what you've learned and how you've applied it. I think to me, that's always gets me when I see those aha moments in the students. I'm like, yes.
I had a quick question, and I'm not quite sure how to go about this situation. It's come up in my volunteering, more so than anything. Prior to securing a volunteering position at Children's Hospital Oakland, which is currently on pause as a result of the pandemic, but I've been told, like, how are you going to be able to meet the child's needs if you're not able to play on the floor, provided that I'm wheelchair bound? So I understand kind of where the hospital is coming from, and that the child's needs may be difficult to meet, and that they are used to playing on the floor and things like that. But having to be asked that in two different hospital settings is a little bit confusing, in that, like, I just don't want that to be a way of them saying my physical limitations are making it impossible for me to meet what they're expecting, and then them not being able to provide reasonable accommodations knowing that I'm wheelchair bound. How do I go about that so that situations like that don't impede my opportunities to even possibly secure a position?
Now, I just want to make sure I understand correctly, Sana. So you're saying a hospital employee told you this?
Yes, when I was volunteering, I was going through the volunteering process, like onboarding process, at Valley Children's Hospital in Madera. And that was the first place it was brought up. And then it was brought up again at Shriners Children's Hospital, Sacramento.
And Sacramento's an orthopedic Shriners, correct?
Correct, yes.
Interesting.
Which is also another reason why I was slightly confused, because I thought, okay, you being an orthopedic hospital are well aware of the needs of children and diverse mobility needs. And so the same what I would expect would apply for myself, but I don't want to, I guess, ruin my chances by telling them, no, I can't do that. And at the same time, I don't want to be unrealistic.
Sure. No, I appreciate that. I mean, my thought, especially for Shriners, an orthopedic Shriners hospital, is focusing on your strengths. I mean, working, yes, I've done this for 20 years, and I can honestly say during hospitalization, maybe 20% of the population can be up and get on the floor at any given time. So I find that very odd that that's something
Right.
they're
I mean,
focused
they
on.
were trying to put me in the playroom setting, but even then, you have patients who you're going to have to bring the playroom to them. They're not able to get out of their bed for one reason or the other. And that still tells me that I can still meet the needs of a child without getting out of my chair.
Mhm. Sure. You know, and that may be what maybe they're preferencing during the pandemic. Like perhaps they're not letting volunteers into private rooms at this time or something to that effect. Because you're right. Because if you're only seeing patients in the playroom, the mobility of the patient jumps up a good 60 to 80%, depending on their diagnosis and the fact that they can actually make it to the playroom. But for patients overall, a wheelchair is the same right height for a bedside table, is the right height for a bedroom chair for the bed itself to do one-on-one interaction with a child. And many times children are coming to the playroom in some type of apparatus of their own. So I've had a child that was actually bedridden, had to lay flat on their stomach after a tethered cord procedure for several days. And we wheeled the whole gurney into the playroom so that he could come and play Uno with his peers. So again, I don't think you need to say what you can't do. Show how you are adaptable and how you are modeling for the patients what is possible.
Mm-hmm. Mm-hmm. To me, I think the most difficult part was this was brought up to me well before the pandemic, because my interview with Valley Children's was not April of last year, but April of the year before. And so, this was well before the pandemic began. And I'm thinking, okay, I understand their concern in terms of meeting the child's needs, but that doesn't deteriorate my ability to interact with the child. It may be different, but it's not impossible.
Exactly. And I would be proactive about that when you do get those questions. Be like, oh, here are all the things I'm willing to do. Here's the things I've thought about. Infection control should be a big concern for the volunteer services. I've had a volunteer that has used a wheelchair, and we made a PPE bag for her to keep on the arm of her wheelchair so that she could reach in and grab the gloves, put the gown on, do everything that she needed to do, and didn't need to wait for someone to hand her something off of a top shelf. We had a protocol that she could wipe her wheels down when after she went into a room. So you can kind of speak to things of that, be like, hey, I'm willing to do what it takes to follow protocol. And I feel like I can still do this.
Mm-hmm.
And I feel it would enhance the patient's experience because they're getting to witness all the capable things that they're able to do.
Right. And I feel like the connection might be, there's connection to all volunteers for all patients, but on a different level, because they're able to see a volunteer maybe in the same mobility device as themselves.
Mm-hmm.
And enhances the feeling of not being alone.
Exactly. It makes a community. It's absolutely.
So I just wanted to run that by you and see, what I could do to still, obviously, of course, be honest with the hospital and what my limitations are, but not allow those limitations to dictate whether the hospital thinks I can and cannot volunteer there.
Sure. And you could also point them in the direction of connecting with other volunteer services. Like I said, I've had volunteers in wheelchairs, and I've worked in a few different places. So if they need to reach out to feedback on how easy and how accessible it is.
I mean, I've spoken to a child life specialist about a similar situation, and she said that although her hospital was in a different state, I think she's on the East Coast, they told her that in order to volunteer, she had to purchase a whole brand new chair,
She had to purchase what?
a brand new wheelchair
Oh,
that
interesting.
only the hospital grounds were where the chair stayed.
Oh, so she couldn't bring in and bring out. Well, that's the same as shoes. I find that odd. And similar thing is, we follow the protocol with personal protective equipment and how to wash and clean. I would argue that, but I would say your friend would be the infection control nurse of the hospital. You could ask to speak to that person.
Okay. I want to make sure that everyone is safe, but also that my capabilities are known regardless of my mobility status.
Agreed. And like I said, I could see where maybe there could be some limitations during COVID as far as going into individual rooms and things of that nature. But overall, as a general volunteer experience, I don't see how that should impede in any way.
And if they say that it will, would it be too argumentative for me to say, well, look, I've already volunteered here and here, and I was able to do it there. So like, what would be the difference of doing it at your hospital? To show them it's been done before?
Yeah, I think it's all in your approach and your tone. Again, you don't want to burn any bridges. So,
Right.
but you could just say, if I'd love the opportunity to speak with the legal department and the infection control, just to see what the possibilities are, because it has been done and I know it's been done. And I would love the opportunity to do it here. Yeah, I would just, keep it really positive. Don't be like,
right.
I'll speak to your legal department.
Right, but at least it gives the hospital a new perspective as well.
Mm-hmm. Right. And again, several volunteer service departments have volunteers with disabilities and they make it work every day. So I would encourage them to reach out and be like, hey, talk to your peers. Like, you don't have to believe me and you don't have to believe a child life specialist. Go hear it straight from another volunteer coordinator.
Okay. Thank you, Shelly, for that.
Sure.
Okay, so it looks like it looks like it's been around 20 minutes, so we're just gonna wrap it up with this last question from Julia. She said, I'm finishing my internship next week. Do you have any suggestions for studying for the exam? So she said, I have heard you have to answer the questions based on what the textbook would say.
Oh, yes, this test, it's a thing. So we actually just made a bunch of practice questions. I was like, I wish I could share this. Hint, I wrote one about Vygotsky, but I think the biggest thing is take old practice tests and just keep going at it. Get your study group, quiz each other. It sounds redundant and repetitive, but it's going to help those neural pathways just be like riding, just be a cakewalk for you there. So that is probably the best way to do it. There is everyone familiar with the practice exam on the ACLP? Okay, as I say, use every resource. Talk to anyone about previous questions. Take the practice test over and over again. It's 150 questions, multiple choice. So you think about your stats. The other side of it is get your testing hat on. Be like, right, if you have 4 choices, you have a 20% chance of guessing it. So do the whole narrow it down, try to eliminate 2, then it gives you a 50-50 chance. Things like that. Try to put on your test hat as well as your child development hat. But I will say theorists are your friends.
I did.
Shelley, I had a question for you about the exam itself. I apologize if I interrupted anyone. But for when the exam is it administered online or is it administered on paper? And do you find out right away what the results of the test are once you take it?
So I'm going to give the disclaimer that I'm not an expert. I haven't taken this test in 20 years. I've been doing all of my continuing education so that I never have to take that exam ever again. My understanding is there is an online option now, and you do get your results immediately. Anyone can validate that? Okay, that is my.
I can speak to the CTRS part because I'm a CTRS, so I've taken that exam. And when I took that exam, you took it on a computer and then it immediately gave you your results. So I'm assuming it's very similar to the CCLS exam.
I believe so. Now, Sonia, when I say online, I believe it can only be done at a testing center so that it's monitored by a test official.
Mhm.
As opposed to, in the privacy of your home, make sure you're not looking at books and stuff like that.
Yeah.
But
I
my understanding is it is online.
I think, I don't think it's ever actually pen and paper. I think it's all online at a testing center. But last year during the shutdowns and everything, they moved towards, since all the testing centers was closed, I'm pretty sure you could take it at your house, but they had an online proctoring service that I've kind of used before for school tests because I was in online courses and you had to show your whole room and you had to show everything and you had someone actually watching you over the webcam take it. So I don't know if they still have that option, but I think that happened last year.
Thanks,
I took that in June. I did that in June. I've already taken the test twice. Third time's charm. Oh my God. But no, I took it at home with the proctor and the camera. I actually preferred to take it home. I found it to be comfortable, like in your own space, in a quiet setting. They do have someone looking at the camera watching you. But it is 150 questions, all multiple choice, on the computer, and then you literally click submit and it goes pass or fail. It's pretty awful. So you sit there for 4 hours to tell you if you pass or fail it. But I have my study cards. There are like multiple study groups. If you're looking for a study group, there's like 4 or 5 weekly right now, and there's this giant floating resource page thing going around in Google Drive that's got like hundreds of tests on it. So if anyone wants that Google Drive, I can send you, Julie, all that information. It's all over the place.
Right
Okay,
on,
cool.
Adrian.
You need to be certified to get a job.
Well, not necessarily, but most places require you to be certified within like
What I've heard is
several
6 months to a
after.
year.
So like
Yeah.
I could apply
Multiple
for a
to-
job and say I take my test in like a month or so. Like it went in the future. Okay.
I've personally tried that and I haven't had any luck. Even though it says 6 months of hire or a year of hire. But I don't know that's in Massachusetts. I don't know about other places, but I haven't had any luck. So, and I have a master's in child life and I still haven't been able to do it. So I don't know. I think it really depends. So.
Adrian, we have somebody asking about the testing resources. Do you want to drop I don't know if you have like a specific group that would be helpful, but it sounds like Julia and Taylor were looking for that. So
That's the whole point of community, right? You share your resources.
Exactly.
I did do 3
Okay.
practice questions today, and I got all 3 right. So I am proud of myself for that.
Excellent.
Progress.
Really.
All right. Well, that kind of wraps up the questions for Shelley. I don't know if there's any. Well, actually, do you have any last minute suggestions for studying for the exam? And is there anything you found helpful?
Yeah, oh gosh, I tell you, I'm the world's worst test taker, hence why I get all my CEUs in every year. So I never have to take the exam again. But it was also what inspired me to join the ACLP committee so that I could help write practice tests and like, let's make sense of these. Like, let's make them practical questions. Because I remember on my exam, this is question number 22. I came out like, there wasn't enough information. It was too vague. Like, it could have been any of those. I could have justified any of the answers. So again, I think having the test taking skill is really helpful on top of studying for your theorist. But having those test taking skills of just knowing statistically, hey, when can I make an educated guess versus screw this, I'm just marking C for everything. So, so yeah, be kind to yourself. Just go in and try not to get into your head too much. You know, go in and say like, hey, it's a test. And once that 4 hours is done, I'm washing my hands of it and I'm gonna go treat myself to do something great. So I think that's probably the best advice, is just try not to overthink it. Study, be prepared, practice, but then let it go.
Are you on the committee with Olivia Rushin?
Oh, I think that's the academic committee. I'm on ENT, education and training.
Gotcha. I didn't know if it was the same or not.
Yeah, we have a lot of little subdivisions which kind of intertwine. So it's like, even though I'm after the test part, it's like we've got to support our academic, or else we're not going to have coworkers to.
Shelley, I had a quick question for you regarding once I get there, like securing a job as a CCLS. If you are recently certified or about to get certified, do you have to provide proof that you have taken the exam or are taking the exam in order to get hired? And if so, how do you do that without taking the exam first?
Yes, you will need to do just everything you submitted to the ACLP to make yourself eligible to sit for the exam. You would share that with your employee.
Okay, so it's the same thing you would submit to ACLP.
Yeah. So
from what I've been told, you get an email from ACLP once you're eligible. Is that email also verification because it's directly from ACLP?
not 100% sure, but my guess would be yes, because it's the certifying body. Each employer might be slightly different, but I would think that would validate just like everything else would.
So like, because I know because I was doing the Common App, and the hardest thing for me was to bring or print out the evaluation report with all my courses completed that show like that each course is passed. I'm thinking like providing all of that and my volunteer hours, as well as like the letter that proves that I finished my internship, that internship verification form. Is that what hospitals are looking for?
Well, most things are digital now. So usually you can just, instead of printing out your transcripts, you can just send a file or a zip file to the employer. But each employer is slightly different. So I don't think there's one standard way to do it. They may be looking for different things. But again, if you're just trying to prove eligibility, anything that you're submitting to the ACLP should suffice. And
Okay.
I'm going out on a limb saying, yes, that email that you get from the ACLP should be all they really need. So.
Okay.
Anna, are you talking about like internship eligibility or job eligibility?
Both. Both. Because for job eligibility, you need to prove that you meet criteria for an internship.
For
For certification. But when you have an internship, you have to prove that you've done your courses. So like the verification form for the Introduction to Child Life course taught by a CCLS would be one thing that I would assume I could submit. But then, like, the eligibility assessment, from what I've heard, it's really hard to like format in a way that's readable to hospitals if you're trying to secure internship eligibility.
So the eligibility assessment on the ACLP website, the only way you can print it off is just the web page. And so that's going to be the same for everybody. So the hospitals know that, so they know exactly what they're looking at. So it's not I wouldn't say it would be hard for them to read since they see those literally in every single application.
It's I don't know, I just think like it's really small when it comes to like the being on the web page, but I guess like if it's that way for every student, then hospitals are used to it, you know what I mean?
Yeah, I wouldn't worry about that. That should be the least of your concerns, honestly. It doesn't look nice. It's not going to look nice. They're used to it. It's okay.
That's what I'm worried about. Like, am I doing something wrong? Because it doesn't look all.
Nope, it looks ugly.
It
Yeah.
does.
That's not nice.
Sorry, that's my phone.
And if it's from an internship perspective, like if you're doing this to apply for an internship, it's child life specialist eyes that are seeing this, so they know the routine.
Yeah.
Don't stress about that.
Yeah.
Like they've been through it themselves.
Exactly.
Well, and they read lots of
150 of them.
lots. They get, I mean, between like 50 and over 100 each round. So
Yeah.
they know what they're looking at. And then for jobs, I mean, I've looked at a few job applications and none of them have like required like a certain form that says you're eligible. I think it's pretty self-explanatory if you finished your internship that you're going to be taking the exam. So I don't think anyone's really going to lie about not having a child life internship. I mean, that's
You really
Is
can't.
is there a limit to the amount of times you can take the exam? And if so, if you don't pass it within that limit, what happens?
Oh, sorry, Sandra, we lost. You sound a little muffled.
Sorry, is there a limit to when and how many times you can take the exam? And if you don't pass it within that limit, what happens?
I don't think there's not like a time frame. I mean, if you get a job, then I think you have to get it within whatever time frame the hospital set, like the 6 months to a year.
Mhm.
But I think there's a max of 5 times you can take the exam. And then I think after, is it the third one that you have to wait an exam period before you take it again for the 4th time? And if you don't pass it the 4th time, then you have to wait another exam period before you take it the 5th time.
That's really annoying.
So, I mean, I guess they're wanting you to just spend more time studying. I mean, I get it. It's kind of weird, but and the exam goes in March, August, and November. So you can take it 3 times a year.
And I just wanted to chime in and say that I do know some child life students who became a child life specialist, and they didn't have to get certified right away. So that my friend is she's in Florida at Johns Hopkins, so she got hired, didn't have the certification yet. So just know that it's not always a thing that you have to get certified right away. They will give you time to take it in certain hospitals.
Yeah, I think it just depends on each hospital.
Yeah, on the hospital, the
how they
state
operate.
too. Yeah.
Okay.
One last question.
Sana, it's getting kind of late, so we really need to wrap it up. Sorry to
Okay.
stop the
Sorry.
questions, but
One last question. Okay. Is not getting certified before you is not getting certified before you start working ever a liability issue?
Each hospital's different, but yes, it can be. That's why they usually put a time limit on it.
Okay.
So they would
Right.
call that a probation period.
Okay. Okay. Yeah. Okay.
okay. Anyways, so thank you so much, Shelly, for answering questions for us, and sharing your insights. You are welcome to stay. We're gonna play categories tonight. So it's not gonna be too terribly theory-based tonight. We are gonna do Jeopardy tonight, but Taylor is not here because she's busy doing internship and grad school. So, and that's like her baby. So I didn't want to do it without her being here. So we're gonna play categories. So it should be pretty fun. So let's get started. So you will need a paper or pencil, or you can type it in the chat. Either way.
So can I make a quick plug? I
Yeah,
won't
go
share my
ahead.
screen because it's time sensitive, but the ACLP has done away with the forum, and this month they started the ACLP Connect. So I just want to encourage everyone, one of the groups on there is called Aspiring Child Life Specialists. Join that group, and that'll be another great place to grab resources and stuff like that. Thanks.
Awesome. Thanks for sharing that, Shelly. I'm sure that'll be really helpful for a lot of people. Okay, so thank you, Shelly, again. Okay, getting started. So has anyone played categories before?
I've played it one time, but I forget kind of.
Yeah, I'll do like a little reminder. So I will give you categories. So for example, oh, looks like there's a question in the chat. Sorry, I was on a different thing. Did you mean on Facebook, Shelly? No, this would be on the ACLP website. You're welcome to share it, Shelly, quick if you want to. Or we got time.
Oh, that's okay. No, go ahead. I'll just put the link in the.
Oh, perfect. Okay, so categories is a game where I will give you a category. So the first category we're going to do is ways hospitalization affects children, and then you will have to list as many things as you can think of for ways that a hospitalization affects children. And then we will go through and compare answers, and if there are overlaps, then you get a point off for the if you get an answer that somebody else didn't get, then you get points for that. And if you don't get, and if somebody else has the same answer as you, then you don't get a point for that. Does that make sense?
I put it in the chat because I'd forget the topic.
Okay, that's perfectly fine. We'll put them in the chat every time. But yeah, if you want to write it down, you're welcome to, or if you want to type it in the chats, either way is totally fine. Okay.
Sorry, Liz.
Yes, go ahead.
When you write down your ways, do you like show it on the screen or do you just type it in?
No, you can just type it in. And then afterwards, do we want to put a time limit on it? Give you guys like yeah, we'll give you like 60 seconds. Does that sound 60 or more? Like a minute? Okay, we'll try a minute at first, and then we will go from there. If we need a little more time, then we will go from there. Sound good?
Do you just put as many ways as you think?
What?
Sorry, do you just put as many as you think?
Yes.
Okay.
Yeah, we're just gonna go with just put as many as you can think of. I think in typical categories you give a number, but like
it's a letter. It's like for this categories, it's like one topic, and then you roll this like big dice.
Oh, okay.
And then it's like whatever letter it lands on, all your answers have to start with that letter.
Okay. Yeah. Do we want to do it that way, or is it more? I think it's more fun to like free and more learning opportunity to just free do it.
I was gonna say, I feel like it'd be more helpful. I feel like doing it that way would be super hard. Specific. Yeah, it would be really hard.
Okay, so let's do it. So I will put a timer on my phone for 60 seconds, and then I will say go, and we will start out with the first one. So the first one we can do like a test round and see how it goes.
Question.
Totally fine, Kelsey.
Does it have to be one word, or can it be like a little phrase?
Ooh, I think it can be a phrase. I think
Or
that's
like one
fine.
word, but like maybe we explain the word.
Yeah, that would be fine.
Okay.
All right, timer. Okay. I'm gonna put 60 seconds on the time and then we will get started. Okay. Are we ready? Ways hospitalization affects children. 1, 2, 3. I don't know if you can see you really can't. No, it's too dark. Okay, that's time. Was everybody able to kind of get a bunch? Okay. All right, perfect. So it looks like Julia put hers in the chat, so we can start with hers.
I got
So-
nervous.
You're totally fine.
Sorry, I messed up when I was trying to type it.
Oh, you're totally fine. That will work too. Okay, so Julia said regression, privacy. So did anyone have regression? Did anyone have that?
It's a
Bonus,
hot word, guys.
bonus points if you can think of a specific age group that it's good for, or that it like,
Regression.
yeah,
Like potty training ages.
yes,
Toddlers, yeah.
yes.
School age kids missing out on school.
Yes. Okay. Looks like we also got privacy. So bonus
I
points
said
as well.
privacy too.
If you, okay, so that one, don't get a point for that one. So bonus points if you can think of the age group that privacy is the most important for.
Adolescents.
Control issues. So loss of control. Did anyone get that? Yeah, okay. It looks like Adrian got that one, so no points for that one. Self-esteem.
I got that one.
I had that one.
Okay, that one as well. Okay, bonus points if you can think of what age group that one's good for. Or like most important for, I should say.
I feel like I should say
Adolescent.
it.
Adolescents.
Adolescents and school agers. Yep. Attachments. Yep, Adrian got that one. Okay. And that one, what age group?
All of them.
Preschool toddlers.
Yep, like infants and
Babies.
toddlers, because they're the ones who are most attached. Okay. What do we got next? Anxiety.
I had that.
Okay. And then age group for that one?
I would think all.
Mostly adolescents. When you're thinking about it, they're the ones who are thinking most like adults, so they have the most adult-like reactions to it.
But the kiddos have anxiety because they don't understand what's going on.
I mean, that's a different type. I feel like that's a different
There's different types, but I would say
Yes.
it would be for all.
yeah, no, anxiety is definitely for all, but like when you're thinking about like anxiety as like a reaction to hospitalization, like specifically just anxiety, I feel
I don't know. I think of all kids.
I mean, either way.
I've seen an anxious 2-year-old. I've seen an anxious 5-year-old.
I mean,
10-year-old.
yeah, makes sense.
Yeah.
Yeah. No, I totally agree with you too, because it can be for all. But like I was thinking specifically more for adolescents, but it is for everyone. Homesick, which I feel like that would be for all age groups as well, being homesick. Strangers. So stranger
danger.
anxiety. Anyone wanna say what specific age group that one would be for?
I would say infants and like toddlers.
Yep, I was thinking toddlers.
So
Starting at
stranger
6
danger.
months for
Oh, sorry.
infants. So
Yeah, 6 months.
I
Yeah,
would
that's
say,
sorry, that's what I meant for
into,
infants. It's expensive.
into like grade school, because especially if they're coming in on a trauma and mom or dad isn't with them and all these random people are coming at them. Ooh, that'd be scary, guys.
That would be very scary.
Developmentally, kids between 8 and 10 months is when they start to prefer a primary caregiver and shun all the others. So that's when you're really going to get that white coat syndrome, stranger danger. The first 6 months, they'll attach to anything because they need their needs met. So
They're like, you are meeting my needs. Yes, yes, please. Okay. Peer relationships. I feel like this one is definitely more of a school age and adolescent thing, but it can be for younger age groups as well. Okay, and then Hannah said in the chat, I feel like anxiety sticks out for adolescents, maybe because they can name it better. That could be true too. Did anyone have any that weren't said that wanted to share?
I put falling behind in school.
Oh, yep, that's a good one.
And developmental delays, which kind of goes with that, but can also be, different delays in just school.
I put in the chat socially, because I know like toddlers talking later. I guess that's kind of regression too, but sometimes they talk.
Delayed skills
later.
development.
Yeah. Social skills, I guess, would be better.
Yeah, delayed skills development.
Yeah.
I had separation, like from school and family and peers. Like, I don't know, because if your family can't stay the night, or if you don't have visitors one day, having that separation anxiety.
Of course.
I also put body image, but I kind of felt like that kind of went with privacy, like Julia said. So, but I mean, it could be different too.
I feel like that's I feel like it could be viewed as like a different thing.
Yeah.
Yeah, I think that's different.
Yeah, privacy is more like I want no one to see me, and body image is more like I view my body as not as good as others or things like
Right.
That. Especially if like the kids have like medical devices, then that's when body image gets really bad too.
Yes. Is there any other ones?
I was thinking like just watching, there's a likelihood of a caregiver or parent being stressed about like the child's hospitalization, and I think there's potentially some guilt and just like that's difficult to experience your family being stressed about you. I think
that's a good one.
I thought of another one.
Okay,
motor
go ahead.
development, especially like if like burns or something, if they have to get their hands kind of wrapped, then they don't move their hands for weeks, and then they kind of have to reopen them up. I do a lot of burn stuff.
Yeah, no, delayed skills development with that as well.
So you ladies are like hitting it, but kind of skirting around it. The 5 types of development: you got cognitive, social, emotional, physical, and moral. So you're touching on each one, but those are the 5 ways to impact development, is those categories.
See, I told you she's amazing at explaining development.
What were those 5 again?
Physical, cognitive, social, emotional, and moral.
Moral.
So moral comes a little later, but you can learn right or wrong early on. It's just more concrete. It becomes more abstract the older you get. And think of a hospital setting like, hey, I'm allowed to torture you, and there's no right or wrong way. Thinking like a toddler or preschooler. This is just random selection that I get poked every day versus, that I did something wrong. That hits that category pretty hard in the hospital setting.
Okay. Was that all of them for this one? Go ahead, Ashley. Go ahead.
Hi. So could you answer, like, if we're say that question was asked, do you answer either way, like naming off development, like socially, emotionally, like Shelley was talking about, like social, emotional, physical, cognitive, moral, or should you name the other way, or either is like both either answer?
Saying like if that's a question.
Yeah, like say that's, or maybe that's like, say that's an interview question or something, like could you say like social, emotional, cognitive, if they asked you to name the hospitalization, that how it affects children, would you name off development like social, emotional, or could you name like what Julie was saying, progression, privacy?
I personally like the 5 because it kind of umbrellas everything that all you ladies have discussed tonight. So maybe list the 5 and then give an example of each.
Okay. Because I was thinking on, when I started, I was thinking like the development, but then I also like what Julie said. So, okay, so list examples. Okay.
Yeah, so like Julia was saying with the motor, physical development, their gross motor skills may be limited,
okay,
not be on track. Moral, they're having, what they're being told is right or wrong. Like don't let someone touch your private parts. Well, now they're having to have their private parts touched. So you could like probably give an example of each category.
Okay, I see what you're saying. Okay, thank you. That's helpful.
For internships and practicums, like, do they expect you to know the same in the interview? Like, are the interview questions going to be as hard for the practicum?
Mm-mm. I would say that the practicum ones are slightly easier.
I would also say, from my experience, oftentimes they don't usually ask you developmental questions. Now, sometimes they will give you one. I've been asked like 1 or 2, but I would say most of the time it's more situational questions, like tell me about a time when you were in a stressful situation, or those kind of things.
The time when this specific thing has come up during internship interviews for me, like this specific thing we were just talking about, like the hospital responses, is when they ask you to break down each stage of development, and then they ask you to include a hospital stressor for each. That's what I've seen it in internship interviews. So just putting it out there, that's where I've seen it. So that's a good way to like think of it as well, is connecting it with an age group, connecting some of them with age groups so that you can then slip those into there as you're explaining the age groups.
One last thing I'll mention, sorry, and then I have to run.
Go ahead.
The family dynamics, how the stress trickles down. Someone started to mention that, but it's so multifaceted. So like, oh, mom and dad are spending all the time with the sick kid, so then you get resentment from the siblings, and then dad's going to lose his job, and then we're not going to have benefits. So just like all the stressors and how it compounds, especially long-term care. So just a kind of showing that you're thinking of family-centered approaches and all the stressors that because with the child comes a caregiver. Even if it's an abusive family or a neglectful family, there's still some form of a caregiver that comes with the child, whether they're there or not. So.
Thank you for sharing that, Shelley.
Yeah, my pleasure. It was so nice meeting everyone and seeing some familiar faces as well. You ladies keep up the great work. I love seeing community. Yay.
Thank you for joining us, Shelley.
All right, have a great night. And if you don't mind, I'll put in the chat box.
Yeah, no, that'd be great.
Feel free to reach out if you got any questions. And also, if you have any suggestions, we're always trying to figure out how to merge the academic world with the clinical world. So yeah, what things you would find helpful in any way, shape, or form, whether that's virtual, physical. think of all the developmental categories. All right, you ladies have a great night.
You too. Thank you, Shelly. Thank you so much. All right. Did we touch on everything that you guys were thinking for that one? Do you guys want to move on, or that you guys had for that one? Are you ready to move on to our next
I have
question?
one more.
Okay, go
Fear
for
of
it.
bodily fluids. That's a big one.
And bodily mutilation is one that we didn't
And
cover as well.
mutilation as well.
And I'm trying to think of some other ones, because I have some other ones that I had in some
What
of
did
them.
she say about bodily fluids?
Yeah, fear of bodily fluids.
Fear. Oh, okay.
Yeah. And then I said bodily mutilation and bodily injury. And then like with preschoolers, you can have like fear specifically of being like mutilated in the genital area, with being in what's his name? Being in
Freud.
the genital stage of Freud. Yes. Could not think of the name at that moment. But yeah, being in the genital stage of Freud, they can have a lot of fear in that as well. Okay.
Also the fear of reality versus fantasy. Just like we think of like egocentric development and like that magical thought, especially in toddlers. So definitely think about, that, it can really be caused by the proximity of magic as well, especially in that toddler preschool age.
And fear of the unknown with that as well, not knowing. Sometimes you have to think of even us. When we don't know, we just think of the worst possible outcome that could happen. So that can be really hard for little kids too, because they, especially with the toddler age group, they come up with these frightening fantasies, and then they just expand on those and expand on those, and the reality is actually not as bad as what they've come up with in their brain, the fantasy that they've come up with in their brain. Okay, let's move on to the next one. So sometimes you get asked about interventions for different age groups. So I thought that we could now move on to that. So interventions for an infant, and I'll put that in the chat. Interventions for an infant. Okay, I am going to start the timer now. I should really have some music here. So quiet. All right. Okay. Time is up. Okay. Looks like we have some really great answers. So, sweeties, does everyone know what sweeties are? Because I've experienced them before, but I don't know if everybody's like heard of them who's in this chat. But basically it's just a pacifier that's dipped in sugar, like a sucrose solution, basically. And it really calms infants down.
It
Pacifiers.
doesn't work over 6 months though. So you can't do a child over 6 months. It won't work. It has to be either 6 months or less.
Good point. Pacifiers, talking through procedure, Okay. Do you mean like with the
So-
parent?
With this, with even little ones, at least at my internship site, we always try to still talk the baby through what they're going to experience, even though they may not fully understand it. They can still like know that somebody is softly talking to them while something scary is going on. So I still say like cold and wet and all the kind of sensations. So someone is still talking to them the whole time. And yeah, I mean that's what we do.
No,
We
that
still
makes
do that
sense.
to babies.
Makes sense. So a fancy word for that is diversional conversation. Well, that's for more later, but diversional conversation. But like that would be more for like when you're actually like having a conversation though with somebody. What were you gonna say, Julia? I could tell you were on meeting.
Oh, you can tell when people unmute? Wild. Oh, just diversional conversation stuff that I did with a 5-year-old today. I can chat later about it. It's cool.
Singing or music, those are great. Did anyone have any of these, by the way? Okay.
I had music.
Okay.
I put soft
I had
voice,
comfort
but
hold.
Yeah, soft voice kind of, I would say, counts for
yeah.
the talking using a soft voice. Did anyone have sweeties or pacifier? We forgot to do this. Okay, yeah, Adrian had those. Rubbing their head or their hand. Did anyone have
I had
those?
touch, like, because I
Yeah.
put lights, music, touch.
Yeah, like
Same
infant
thing.
massage. Swaddling. Did anyone have swaddling? Okay.
Yes.
Yep. Cuddling. You have that, yep. High contrast. Okay. What do you
Pictures,
mean?
like
Oh,
black
like
and white
high
pictures
contrast
for babies.
pictures. Yeah. I
Sorry,
get what
not
you
like
mean now.
color medicine. Black and white pictures for
Yes.
infants.
Yeah. I get what you mean now. I would like couldn't I like
I
just
wasn't
didn't
trying to write
understand.
a whole thing about it.
Oh, I get it. Rattles. So it looks like Ashley had rattles as well. Did anyone have the high contrast pictures? Okay, so it looks like you got a point for that one, Julia. Oh wait, hold on. We had that movement. So I'm assuming you mean like holding or like moving the infant back and forth or like
Yeah,
rocking
like
them,
swaying or bouncing or the mamaroo or
stuff like that.
rocking.
Reading, talking. Wait, isn't that the same thing as talking through the procedure?
No, just like after a procedure or
Oh,
something,
okay.
just like chatting, just babbling along. Have conversations with babies.
I had one today. Parental presence is another one. Did anyone have that? Yeah, okay, perfect. And then it looks like we have mirror play, which mirrors are hilarious to watch babies playing. Even my toddler, so I work as a toddler teacher, and we have a mirror in our toddler room, and they just go up to it and like make funny faces with each other or like in the mirror for like minutes on end. It keeps them entertained. I love it. Did anyone else have mirror play? Okay, it looks like you get a point for that. Tummy time. Tummy time is like essential for infants. Playing with a rain stick. Shakers, rattlers, things like that. Yeah, all of those are great. And looks like we might have had some of them. Did anyone have any others that they wanted to add? That we may have missed out of those? Give everyone a second. Put their input in. Otherwise, we can move on to the next age group. Yeah. Okay. So our next one that we're going to do is interventions for toddlers. Okay. And I actually brought up music this time so we can actually like listen to music while we're doing this. Okay, wait, hold on. Thanks for joining, Julia. All
Good
right.
luck, everyone. Adrian, are you taking the exam in March? We got this, girl. I'll be
Good
cheering you
luck.
on. All right,
Yeah,
bye.
thanks. Good luck.
Thank you.
Study, study, study.
All right. Let's get started. 1, 2, 3, go. Oh wait, I forgot to play the music. Can you guys hear it? Okay. 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 Oh wait, I forgot to put it in the chat. Oh well. Okay, interventions for toddlers. What do we have? Who wants to start?
I have prizes, like positive reinforcement.
Okay, did anyone else have those ones?
Don't really have anything theory I'm thinking to back myself up there, but and then incorporating mom or dad or caregiver into intervention
So caregivers.
of sort. These are kind of specific, yeah. Just making whatever interactive play, then I get broad and I'm eating my dinner, so.
You're totally fine. All right, so it looks like Ashley said play with balls outside. Always a fun one. Dancing, music, stuffed animals, parent support, home routines. So routines are really big with toddlers. Yes, Taylor, bubbles are the best distraction ever. My toddlers love them. They love I brought them out one of our first days, and then they kept asking me to bring them outside every single day. So then every single day outside, we brought bubbles out. They loved it. Play. So letting them play. Always good. Choices are big, especially with this age group. You have to think they are in Erikson's autonomy versus shame and doubt stage. So they're wanting to make those choices, and they're wanting to have the autonomy to even go about making those choices. And if they aren't allowed to make those choices and make those mistakes, if they do make a mistake in their choice, they won't have the ability to develop that autonomy. Plus it avoids a lot of temper tantrums. If you just say, do you want to do this or this? These are your choices. Like there's not a third option. Medical play, some simple, easier medical play is always good with toddlers as well. Giving them a sense of control. This is always good. Toddlers are ones who always want to feel like they're in control. Distraction from procedures, another good one. So what are some specific distractions that are really work really well with toddlers? Does anybody want to?
You could do simple things with like IV draws. So you could do books, you could do iPad, you could do bubbles are huge. You could do, what did we do in the ER that was really good? We used we called it like our something stick, like our like safe stick we used to call it, and it was like a one of those like rain sticks,
Rain
but
sticks?
the bubbles went slow, so like by the time it was over, like the IV would already be in. It was like a counting. It was really cool.
Oh yeah, that's
You know
really
what I'm
cool.
talking about? It's like a lava lamp.
Yeah.
That was pretty cool. Stickers,
Stickers are big.
songs,
Mhm.
comfort holds. I didn't mention that one. That's a good one. That's the comfort holds with attachment givers, bear hugs, that kind of thing.
Bubbles and music are really big with this age group for distraction. And light spinners are really good for this age group too. Attachment. So were you thinking like attachment to the caregiver? Was that what you were thinking with that one? Okay. Yeah. So like being comforted by a caregiver. Bubbles, Taylor said. Any other ones that people wanted to say? Okay. So it is getting kind of late, especially for our East Coast friends. So did we want to wrap that game up there and go into questions now, or did we want to keep playing? I do have some more prompts for this game. So we could keep playing, or we can kind of wrap it up and move on to some interview questions. I'll kind of leave that up to you guys. I don't want to keep our East Coast friends up too late, since I know people have work and stuff tomorrow.
And some interview questions would be good. That's just my idea.
Okay.
I'm flexible. So.
All right. Maybe let's do 10 more minutes of like one more prompt, and then we can do some interview questions. Does that sound good with everyone?
It sounds good.
All right. I just don't want to like go too long, because I don't want people to like have to stay up or anything. So our next age group is activities. Do we want to do another activities ones, or do we want a different one?
Let's get more technical.
Okay.
Do like a harder question.
Okay. Let me look at some other ones. So the theory one that I have that I kind of liked was names of theorists and or parts of theory. So basically just kind of name some theorists that you can think of, and if you want to connect the parts of the theory, you can, or if you want to just name all the parts of the theories that you can think of, and then we can kind of go through. We're not gonna like go through all of theory tonight, but like we can go through and like talk about them and like talk about some of the different theories. Yeah. Okay. I'm gonna give you guys, do you want a little bit longer for this one? Like a minute 30, 2 minutes? What are we thinking?
Can you put it in the chat, Liz, if you don't mind?
Yeah.
Okay,
Yeah.
thanks.
Let me throw it in. Do we want to have 2 minutes, or do we want to have 1 minute for this one as well?
I think
2?
2 would be good.
Okay. I'll give you 2
Yeah.
minutes, and then if you guys are all like, I'm done, just let me know. Okay, I'm gonna throw on a song and then we'll get started. Okay. 1, 2, 3, go. All right. That was time. So what did people, okay, perfect. So Adrian has Bowlby, which is the attachment theory. Parton, which is the theory of play. Erikson, Piaget. Those are ones that we should know. Bronfenbrenner, Langer, is that how you say that one? I think so. Spiess and Brent, 3 essentials of death. Okay. I was reading like the word was wrong, so I was like, I think she's trying to say essentials there. Kibler and Ross, always a good one. Which is a death and dying one. Answorth, which is the secure base one. Vygotsky is also secure base, and with that scaffolding as well, and the zone of proximal development, always a good one. Lazarus, Folkman, so the stress theory. Any other ones that people thought of?
Kohlberg, moral.
Wait, which one?
Kohlberg.
Oh, Kohlberg.
Kohlberg.
Did anyone think of any other ones?
Do you think we need to know Freud? Like, I don't remember really learning about it in school, but do you think we need to study that?
So it's actually one of my, like, Taylor, who helps me run this, it's one of her favorite ones, but a lot of child life specialists just don't like it. So I don't know if I would like know of it, but I wouldn't like extensively like study
I've
it.
never seen a test question about Freud, but I was just curious to see if I should just put it in my flashcard pile or not.
In that case,
I'm trying to
you've never
keep it
seen-
as small as I can. So if I don't have to put it in there, I won't.
Yes. I think if
So-
you've never seen a question on it, I wouldn't.
Okay. I've never seen a question on it, so I was just curious.
Yeah, I wouldn't then. I don't think that it, if you've never seen a question on it, then it's probably not on the test. All right. That was categories. I hope that was fun for you guys. A little bit of a different way to learn. Okay. So, some interview questions. So these are questions that either Taylor or myself have gotten during internship interviews. I've been through 5, this is my 5th round of internship interviews, so I've seen a lot of different questions. So we have 3 for tonight, so we can kind of go through and discuss them quick and then kind of wrap things up. But I would love for you guys to be the people who kind of go through and answer them, because we learn best through answering them and getting feedback. So I think that's the way we could kind of discuss this. But what are the main tasks and jobs of a child life specialist?
I can answer that.
Yeah, go ahead, Ashley.
I would say emotional support, and then also kind of explaining like what's going to happen in a way that children can understand. Also helping the child process whatever just happened or something that's going to happen soon, through medical play or just play in general, like normative play. And then also child life specialists do medical play and also just provide interventions that can be play-based or just interventions that are very comforting to them, like bubbles or those kind of things.
Yeah. Did anybody else want to add anything to that one? I always say like advocacy is a big task of child life.
I just realized I missed bereavement too.
Oh yeah, bereavement's a big one too.
Bereavement
I feel like
support.
there's so many different tasks. We wear so many different hats as child life specialists. So
Yeah.
I feel like there isn't really a wrong answer. There just really looking to see kind of what you think with that one. And then why do child life specialists provide play? Did anybody else want to answer that one?
Maybe because it's just part of supporting the children in normalization, because play is so innate for kids and all of us really, but often, you know, adults are very business focused, and so so play is part of the normalization task that the child life really wants to do. And just like development too is how like we want to support development, and play is how kids learn. It's everything.
Did anybody else want to add to that? I know I always say normalization, like you talked about. I'm trying to think of some other things that I always say.
Education too, like providing like in medical play, like you're wanting to educate in a developmentally appropriate.
Yeah, of course.
Sorry, I'm cutting you off.
Oh, you're totally fine. No, go ahead.
That's all I got.
And then what is a skill you are really hoping to develop during your internship? Another one.
I was going to say advocacy.
That's a good one.
Because I feel like during my practicum, I was able to see like a lot of medical play, and I was able to see like how the child life like introduce themselves. So like I didn't really get to see a lot of like advocating for as much for children and families.
Yeah. Does anybody have any other ideas of what they may be hoping to learn during their internship? Otherwise, we can kind of wrap it up here. It's really all we had for tonight. I didn't want to keep you guys too terribly late, because I know it's a Wednesday night. We all need to kind of wrap things up.
Thank you.
Yeah, and I will post the recording. I'll try to either tomorrow or Friday, the end of this week.
Thank you, Liz.
Thank you. This was
Yeah.
helpful.
Thank
It
you.
was fun.
Yes. And come back next Wednesday. We're having it again next Wednesday. So, all right. Thanks for coming, everyone. I hope this was helpful.
It was. Thank you.
Yep. Bye.